pretty much rock and roll. There she is. All right. How do you know if your back is in pain or if you have serious back pain? What is the most common cause of back pain and how can you fix your back pain? Hello and welcome. I'm your host, Dr. Musamtombeni. Signing with us today is SABC. Now, Back Care Awareness Week is celebrated every year, usually in October, and this year it is being held from the 3rd to the 7th of October. This week is organized in an attempt to raise awareness about back issues as well as how to manage back pain. On Vital Signs, we'll focus on back care. Coming up on the program, we'll listen to two women speak about how their constant back pain and how they've tried different types of pain medication and therapies to ease their pain. We'll speak to the head of physiotherapists from the back clinic about how to take care of your back and reduce injury. And we'll listen to interviews done by Zama Buthelezi at the 24th Association of Medical Councils of Africa International Conference, hosted by the Health Professions Council of South Africa, that is underway at the Sun City Resort in the Northwest Province. We spoke to the registrar, she spoke rather to the registrar from the Medical and Dental Practitioners Council of Zimbabwe about the role of these councils in building a resilient workforce. And she also spoke to the president of Health Professions Council of South Africa about facilitating an exchange of information and meaningful collaboration amongst health professionals or health practitioners, regulatory authorities, which will provide development of concepts and new approaches in health practitioner regulation. That is a mouthful. It's a lot. So we're on air. Muzwaki Mtumbin. Yo. Oh, damn. I'm on reverb hands too. I like that. Nah, keep it on. This is sexy. Sorry, wait. How do you know if your back pain is serious? What is the most common cause of back pain and how can you fix your back pain? Hello and welcome. I'm your host, Dr. Musamtombeni, and signing with us today is SABC. Now, Back Care Awareness Week is celebrated every year, usually in October, and this year it is being held from the 3rd to the 7th of October. Now, the week is organized in an attempt to raise awareness about back issues as well as how to manage your back pain. On Vital Signs, we'll focus on back care. Coming up on the program, we'll listen to two women speak about how their constant back pain and, of course, the different remedies that they've tried, including pain medication and therapies to ease their pain. We'll speak to the head of physiotherapists from the back clinic about how to take care of your back as well as reduce injury. We'll listen to interviews done by Zama Buthelezi at the 24th Association of Medical Councils of Africa International Conference, hosted by the Health Professions Council of South Africa, that is underway at Sun City Resort in the Northwest Province. She spoke to the registrar from the Medical and Dental Practitioners Council of Zimbabwe about the role that these councils have in building a resilient workforce, and she also spoke to the president of the Health Professions Council of South Africa about facilitating an exchange of information and meaningful collaboration amongst health practitioners, regulatory authorities, which will provide for development of concepts and new approaches in health practitioner regulation. Remember, you can be part of our show by asking the guests that we'll have on any question that you may have on your mind by simply sharing your view with us on what we're discussing. The number to call is 011-714-0677 or 011-714-0678. Also available on social media at SABC Vital Signs on Twitter, and on Facebook it's SABC Vital Signs. The show will continue right after this ad break. Stay with us. Welcome back to Vital Signs. I'm Dr. Musa Mtombeni, and namhlanje sikhuluma ngenkinga zeqolo. Of course, all the pain that you would generally suffer mawusoba ngathi umdalanyana. So yinto sokhuluma ngayo namhlanje. Now, pain in the lower back is a common concern, affecting up to 40% of South Africans at some point in their lifetime. We'll speak to Marsha Marnowick and, of course, Chantel Neetling about the constant back pain and how they tried different types of pain medication and therapies to ease their pain. This is their story.
Back pain is not often considered to be a potential problem among young adults. However, when back pain strikes at a young age, it is usually the result of hard exercising, a job that requires heavy lifting, or a sudden awkward movement that causes the back strain. Chantal Neetling is a 23-year-old young adult who unexpectedly started having back pain.
Pain started 2 or 3 months ago. It just started, and then then I went to the doctor to see what it actually was. My symptoms I experienced was my one left leg went numb and pins and needles, and then my left arm just completely went numb. And with all the pain down and everything.
After trying home remedies such as stretching, she eventually sought for medical help because the pain was getting worse and started to affect her daily life.
He took x-rays, and then they said on my upper body it was spasms, and then my lower back as well, spasms pressing on my nerves. I didn't really take pills because I don't like taking medicine, so I just tried to lay down and stretch my leg or pull my arm up, or just to see if another position will help with the pain.
Chantal had muscle spasm and was treated with biokinetics and muscle relaxer patches. She emphasizes the importance of seeking help before things get worse.
When I walk too much or stand too much, I start getting pain every way, so I couldn't walk too far distances or anything.
Adults aged 50 years and older are especially vulnerable to lower back pain caused by age-related wears and tears of spinal disc, joints, and other spinal structures. Marsha Marnwig, aged 61, shares with us how her back pain has affected her life.
My back pain actually started in my airline career when I used to be a flight attendant. But you just soak in a nice Epsom salt bath and it's fine, you know. But my back pain actually got worse this year with my training with being a care worker, and experienced lower back pain. And that's when I realised there is something happening here. The symptoms that I experienced was that I had a pain that went down my right side and actually paralysed my leg sort of. And it made any move, it was difficult to get up when I was seated down. To get up, I had to basically support myself to get myself up. But this is not a good sign. I could still walk and still do things, but it was just not, I wasn't very mobile at all. Not the way I'm used to, you know. So I thought, maybe I should go and see a doctor. And I ended up in hospital for 4 days. And a neurosurgeon said, we'll go the physio treatment before we go surgical, because that's their last option.
She avoided taking any pain medication because of the side effects of pain pills, but she did try home remedies such as hot and cold compresses to help her muscles relax.
I'm not a person that just takes painkillers because for the heck of it. I'm very fortunate I've got a high pain threshold, so I've managed the pain. I used hot water bottles with cold compressor or warm pressing, or that spray stuff that you can put on for muscle, just to relax them. And I used to take Spasmed or Norflex, which is a muscle relaxant, because I knew it was muscle related. Not because bone pain is different to muscle pain. So, but I didn't want to pop too many painkillers, because I know the side effects of the painkillers, because it can be bad for your stomach. I don't want to make one thing worse because you just add to the problem.
The back pain affected her life as she was forced to stop working because it became difficult for her to assist patients without injuring herself.
Actually, I couldn't continue my certificate for my care working because I couldn't deal with the practical side of it, dealing with helping people to bath, making sure that they don't, if they fall, that you can protect them, because that's a physical job. So I couldn't continue with that.
After seeking for medical help, Marsha's doctor suggested that she try dry needling therapy. This is a modern treatment designed to ease muscle pain by inserting full-form needles into your skin.
One of the things that I had no idea of when I saw the physiotherapist and he mentioned dry needle treatment, I didn't know what that was. It's a dry needle treatment where the actual pain is in your muscle, they put a needle in, it's not acupuncture, it's not the same, it's a completely different treatment, but it's a very good treatment. It really gets to the source of that pain. And then also the biokineticus, they show you what exercises you do.
After the ad break, we will speak to Coco Lamb, the head of physiotherapists at the Back Clinic. Of course, we'll be talking about how to avoid getting injured and, of course, all the treatment that you can get. welcome back to Vital Signs. Now, Back Care Awareness Week aims to recognize the importance of back health as well as posture and, of course, provide practical as well as emotional support to people living with back pain. Now, we're joined by the head of physiotherapist at the Back Clinic, Coco Lamb, to give us some tips and, of course, tell us a little bit more about how you can reduce injury and prolong full back capabilities. Thank you so much for joining us today.
Thank you.
So let's talk about back pain. A lot of people know it very colloquially as, you know, a little bit of pain that's in my back. But when is back pain a problem?
So, you know, it's actually very common for people to get back pain. It's actually, you know, let's say maybe 80% of people generally get some sort of back pain in their lives. And, you know, a lot of the times it comes and goes and it's not so worrying. It becomes worrying when it starts affecting your daily function, when it starts affecting other parts of your body, like pain referring to, you know, down your leg or numbness in the legs, in your hands, fingers. So those are generally signs that you should probably consult with a medical professional to see whether it's, you know, something that you should do something about, or it's, you know, because generally back pain do recover on its own. It's known to, you know, to have you have the ability to recover from back pain without doing much. So it's only when the symptoms start getting worse over time, when it's not getting better, then you should probably consult at that time. Yeah.
So what are the main causes of back pain? A lot of people, for instance, would look at back pain as this idea that is an issue of old people, that you've been alive for a very long time, so you're bound to have back pain. But a lot of young people, and I'm sure we saw in the insert as well, get back pain. So what are these causes?
I agree with you there. So back pain is no longer seen as old people's type of problem. You know, in my experience, I've been seeing people as young as school kids, you know. So generally, it comes down to two things. You know, back pain would be caused by misuse and disuse. So by that I mean misuse is basically when you're doing things with your back that it's not designed to do. You know, whether it's poor sitting posture, whether it's repetitive, strenuous activities at work or at home. You know, these things generally tend to build up. It doesn't happen overnight. You know, these problems, we can't really relate it to one incident. It generally happens over time as you put more and more strain on the back and you ignore it. Then, you know, these symptoms start to manifest over time. And so disuse is also one of the causes. By that I mean not using your back, being inactive, you know, not exercising regularly or doing the wrong exercises. Because as your spine or any other joint, to be honest, motion is what keeps it healthy. It's how your joints get nutrients. It's how it stays mobile and fluid and so on. So, you know, for some people, they don't exercise. All they do is, you know, sit at work, sit at home, watch TV, sit in traffic. Your back isn't actually doing that much if you look at it. So over time, your structures start to deteriorate or it gets more stiff. And then it develops into problems like that. So yeah, those are probably the two main causes. And then obviously you have, you know, other pathologies or diseases which might lead to back pain, like arthritis or cancer or you know, stuff like that. So yeah, but those are a little bit more less common. Yeah.
Okay, we've got a caller on the line, Sean from the Free State. You've got a question. Good morning. Okay, I think Sean has disappeared. Maybe he had a question about back pain that he just couldn't get off his chest. So back to these common conditions that you speak of. I mean, a lot of people would think that, you know, injury is one of the big causes of back pain. So if you lift something too quickly and you were not positioned in the right way, that would be a cause of this. Are there associated medical conditions apart from the arthritis and things such as that that would potentially give you back pain?
There are a few, but, you know, back pain is actually not very common caused by other diseases in the body. You know, I spoke of arthritis and cancer being one of them. There are, you know, autoimmune disorders where your immune system is attacking your bones or your muscles that cause pain and stuff. But in general, not really. You know, it is most likely due to what you do during the day on a, you know, over a period of time. Yeah.
Now, Sean is back on the line. Good day, Sean.
Good morning, doctor. Can I carry on?
Yes, you can carry on. What's your question?
Thank you very much, doctor. I've got a back pain, but it's not on my one side, on the right side. It was more on the lower back, but now it's moved middle because I've been starting to do a lot of stretching. When we were in the office, I used to do a lot of exercise. So from 2020, I did not do a lot of exercise. because I've been working from home. I was now only starting to run in the morning and not in the afternoon. And it became so bad that I couldn't run anymore. I started to walk. Now I cannot do the walking even for 1 hour. My back is so sore, but only on the one side, the right side. And it's from the middle to the side, only the right side. Thank you so much.
All right, thank you very much for your question, Sean. So I think we could expand Sean's question to this idea of exercise-induced back pain.
Right.
Is it a big problem that people have where they do exercise and then start having back pain and can no longer continue?
So in general, exercise is actually what you want to do to treat back pain, but in certain instances, you do get exercise-induced back pain, and that happens generally because there's a secondary issue going on besides the exercise that you're doing. So, you could have for the longest time, underlying back condition, whether it's muscle spasms or degeneration or anything, which is now triggered, the pain gets triggered by your exercise. So in those type of instances, you might really want to consult a healthcare professional to see why, because generally exercise is what you want to do, so it shouldn't cause you the pain. So now if it is, you might really want to consult and see what other underlying issues there are in the individual's case to see why it's like that. So in generally, it should actually help. So, yeah.
So this idea of acute pain, for instance, that we'd use as an example of, exercise, where Musa went to the gym, he thought he's stronger than what he actually is, and he's just, trying to lift these weights and do deadlifts and things like that, which will have an effect on my back. And a 60-year-old that's had this pain for 20 years at this point in time. Is there a difference between those types of pains, and are different ways of managing both pains?
Yes, so generally with acute pain, you could almost narrow it down to a certain incident that that happened, or something that you did that might have triggered it. It's a little bit easier to manage, and during the acute phase is actually where you really want to tackle this back problem. You have higher chances of getting it fixed quicker. With chronic pain, it gets a little bit tricky because the longer you have this pain, the longer you have these pains, it kind of starts affecting other areas. Generally, when people feel pain, they might start reducing the activity. They might adapt in postures that, to accommodate the pain. And with that itself, it starts creating a new problem where you are causing imbalance in your body, in your muscles, certain stiffness in areas that were not stiff before. With the chronic pain, you kind of need to dial in deeper into what's causing, because initially you might have said a couple of years ago at the gym I hurt my back, and now it's kind of been spreading, and you kind of have to figure out all the other areas that are now affected due to the original injury. So you'll need a little bit more investigation, a little bit more assessing to kind of figure out the bigger picture now. Yeah.
Belinda on the line. Good day, Belinda. What's your question?
Good day, how are you?
We're very well, thank you.
I just want to know, is it possible for lower back?
Let's try that again, Belinda. If you could just repeat your question, please.
Hi, doctor.
Hi, Belinda. We seem to have disconnected. If you could just repeat your question for us so we can hear it.
It happened that a while back. My adult gender was into the car, my back cracked, and it's been paid for ever since. I've been to doctors, and they only gave me pain. But I went back and said that they basically told me to stop paying the routine, and I cannot do that.
Okay, so we're really struggling to hear what you're saying, Belinda, but I think we'll speak to the idea of treatment, right? So a lot of people experience back pain, and I think we've covered this idea of either acute injury from exercise or injury from car accidents or trauma and things such as that, or just degenerative changes that do exist. But treatment, of course, is available, and there are different modalities that we would use. So what do you and how do you treat back pain?
So treating back pain, you kind of firstly want to determine the main contributing factors of your back pain. So be it bad habits that you have, your work environment, your current lifestyle, and so on. And together with your physical treatment, you kind of need to address those type of issues as well. So I'm a physiotherapist, so I guess I'll speak more about that. As a physiotherapy, what you mainly target on is the areas that are affected, be it your muscles, your ligaments, your bone structure, your joints. So you kind of want to address those issues. You have majority of the time areas that are stiff, where your muscles have become, I like to say, they kind of become malfunction. They start malfunctioning. They don't support your body like they're supposed to. They are not working as long as they're supposed to, so the endurance goes down. So through physiotherapy modalities like massage, dry needling, some machinery here and there, but the main thing for back pain is actually exercise. So through research, exercising, doing the correct exercises is actually the best thing you can do for preventing and treating back pain. Yeah.
So exercise forms a very big part of it.
100%.
And of course, I mean, you're speaking to the idea of physiotherapy, but there are other modalities as well where people would be on medication, for instance, to treat their mild back pain, which obviously is a problem if you're taking very strong medication to treat the pain.
So medication, in my opinion, it actually doesn't fix the back problem. It kind of just masks your symptoms. In some instances, if your back problem isn't very severe, if it's very minor, it might take away the pain for a number of period of time. But in general, medication only masks the problem. And during that period, what you should be doing is doing exercises and doing things that will actually help your back recover. Because otherwise what will happen is you'll start taking more and more heavy meds to try to deal with the pain, or you're going to be on medication long term, which is not the way to go. Yeah.
Well, thank you so much, Coco Lam, for joining us today. Of course, this is Coco Lam, the head of physiotherapists at the Back Clinic. After the break, we'll listen to an interview done by Zama Buthelezi at the 24th Association of Medical Councils of Africa International Conference hosted by the Health Professions Council of South Africa that is underway at Sun City in the Northwest Province. She spoke to Josephine Mwakutuya, the registrar at the Medical and Dental Practitioners Council of Zimbabwe, about the roles of these councils in building a resilient workforce. Stay with us. Welcome back to Vital Signs. With the 24th Association of Medical Councils of Africa International Conference hosted by the Health Professions Council of South Africa underway at the Sun City Resort in the Northwest Province, Zama Buthelezi spoke to Josephine Mwakutuya, the Registrar of Medical and Dental Practitioners Council of Zimbabwe, about the role of these councils in building a resilient workforce. Let's take a listen to the interview.
Talk to me about regulation in Africa. We know there has been many challenges, and we've had such conferences before. And when you look at implementation, not much is being done. What are you looking forward to at the end of this conference in terms of regulation?
Thank you, Sansi. Thank you very much, and thank you for having me. What we are looking at as a continent, we are looking at AMCOA coming up with policies on retention of health workforce, because we need this health workforce. As being alluded to by the ministers and everybody there in the house, and even if I ask any regulator, I'm the registrar of the Medical Council of Zimbabwe, even if you ask any registrar of any regional regulatory body, they will ask you about retention, right? They will also they will talk to you about retention of health workforce. They will also talk to you about scaling up, right? Education. They will also talk to you about scopes of practice, regulating scopes of practice. The pandemic has given us lessons to work as a team. We need to work as a team. So as a region, we need policies. We also need to review our regulatory frameworks. We need to adopt to what we say multi-professional regulation. That's the only way for us to mitigate against these pandemics. It's not only COVID, Sansi. There's also climate change. There's also digital advances, digital technology. Do you know that a doctor from abroad can treat a patient in South Africa without you knowing it? But in terms of regulatory practice, it's not allowed. They have to be registered. So we have to be prepared for that as a region. As African sub-Saharan region, we need to be prepared for that. And also as regulators, the advantage of multi-regulation is that we have uniform standards. and we start regulating scopes of practice as opposed to regulate an individual. We regulate scope. What is your scope of practice? And we promote teamwork. So we need to come up with policies. We don't have time anymore. Disasters are coming. There's climate change. Look at recently South Africa. Look at the floods. India, look at the floods. So we need to be prepared for those disasters. And health regulation is a critical system within an economy, because health is wealth, as you know. Health is wealth. So we really need, as AMCOA, to be prepared for that and come up with policies to mitigate against those disasters. We also need, because multiple regulation also is an advantage of uniform standards of practice. You don't want a doctor in Zimbabwe to practice this way, a doctor in South Africa to practice in this way. We need standards, uniform standards of practicing, and multiple regulation is the answer. This is actually not new to us. That's what I'm not saying from my brain. This is what literature says from World Health Organization. Even if you look at what is happening in UK and Americas, they've also been affected by this pandemic, and this is how they've adopted to it. So we need, but for that multi-regulation to work, we need government oversight in multiple registration. We need, in terms of policy, in terms of changing legislation, so that we move away from what we call self-regulation to regulate the title. We should regulate the scope of practice. In what scope is this nurse practicing? In what scope is this physiotherapy working? Then we regulate that scope so that people don't just start doing things what they are doing. This fragmented registration, it's now a thing of the past. And let me say something, Zanzi. We also need to look at continuing professional development as an African region. We should now move away from CPD, where you come, you have a conference, you have tea, somebody speaks. We should have what we call self-directed CPD. I am a doctor. I know that I have got problems in communication, right? Then I ask a mentor to say, you come and mentor me. And then they mentor me and I improve my communication. Because most of the problems that we face are because of poor communication. So that's what we need as a sub-region, African sub-region. And this is also promulgated as well to say, is we started SADC region, we need to come up with our policies. Then from SADC, we escalate to AMCOA. Remember, AMCOA is the Association of Medical Councils of Africa. East African community, they've got Kenya, Tanzania, Uganda, Rwanda. Yeah, there are about 4 or 5 countries now. They've got their community. Because they are same region, same cultural, same what. You are from Messina, you are from Bedbridge, you are the same. You are from Botswana border and Zimbabwe, Botswana, South Africa, landlocked. We've got the same, cultural and social issues together. Yeah, so we should regulate according to what we have in our countries. So we need to start from SADC level, then we move to Association of Medical Councils of Africa. Yes.
Ms. Josephine, when you say we need to start from SADC level, you look at the challenges that have been faced by doctors who want to move to different countries to work when it comes to registration. And I think it starts from there, where we need to make sure that the processes between countries talk to each other, but that hasn't happened. I mean, AMCOA has been in this space for 24 years, but the countries are not communicating with each other. Do you find that that's another issue that we faced with?
Absolutely, Sense. Absolutely. I totally agree with you. Actually, what is happening, we need to have a policy on migration, as I say. We need to have a policy so that we retain our health workforce. You see what happens, a health worker, I can say we've got, we should be like, no, not coping, but we adapt and adopt, right? We adapt and adopt. If you look at UK, if a doctor wants to go and practice in UK, I'll have to communicate with the General Medical Council. They don't just take our practitioner. I will send what we call a certificate of good standing to them to say Dr. Zanzi is in good standing. But here in our region, a doctor can just jump a border and start practicing there. We should come up with a policy, starting at SADC level, so that regulator to regulator, we communicate, right? We do have to communicate, so that when we issue these certificates, we are issuing to doctors who deserve them. Because a certificate of good standing, that's what we call a doctor. We are saying this doctor is normal practice, this doctor is ethical, this doctor is professional. But if we have our neighboring countries, if somebody just comes with a letter or something, then you employ them. We are not. You are very right. You are very right. We need to talk to each other as regulators. We definitely need to talk to each other.
And do you think this has opened us up as countries to bogus doctors who have seen that there are loopholes in these systems, so these syndicates are able to just infiltrate and come and work when they are not even doctors and putting people's lives in danger?
Absolutely, absolutely. You are very correct. That's why I'm saying regulator to regulator we should talk, because these documents, do you know, with this computerization, nothing, they can be reprinted. A South African certificate of good standing, all they need is for probably, let me talk of Zimbabwe or Namibia. They'll just talk to one of the staff members and get a signature and just put it and do it nicely. So if you get that certificate, you need it to come from the regulator so that you avoid having bogus. Yes, bogus doctors are there. And that's the reason why we want this CGS. That's the reason we want this communication between regulator to regulator. We definitely need that. We definitely need that. You are very correct. That will stamp that problem of bogus doctors, because they are there. Because they just watch you do things and they can pretend up until things go wrong. Then you say, oh, we had a bogus doctor. So we need to have policies across the region. We really need to have policies. And the frameworks, I want to repeat, the regulatory frameworks should change. We should change. We should have a lot of government oversight, because you must know that this regulation is not, it's a delegated responsibility. This is the work of the government. It's within the government. It's actually in the statutes, even in the constitution. It's there, but it's a delegated responsibility. So government must have a strong oversight on regulatory systems, because as regulators, I didn't tell you, our role is to ensure public safety. We are there to ensure, and also accountability by the practitioner. They have to be accountable. That's why we are now looking and proposing to change the old CPD. We could just go have lectures to self-directed CPD. I know my weaknesses. I'm not very good in this area. I ask a professor or a colleague to look after me. That's what they do in Canada. That's what they do in America. That's what they do elsewhere. Australia, that's what they're doing. So it's only us who are still behind. So we need to move as a continent.
Ms. Josephine, talk to us about the outcomes of this conference. I mean, you've traveled all the way from Zimbabwe. What do you want to see happening post this conference? I know we've had conferences like this before, and it's always been talk shop, and when it comes to implementation, we don't see much. In terms of regulation, what do you want to see in the frameworks as well?
Thank you very much, Sans. What I would like to see is probably for the organizers, Professor Nemtandi, who is heading the thing, to call people and then have a strategic plan. From what has been said, let's have a strategic plan. Let's now start from the beginning. I think from the presentation and from everything what has been saying, Minister of Namibia said it too. I said, the minister is now speaking about my presentation. All what you are saying, uniform of standards, uniform of training. We need to come up, we need to have a strategic plan which will follow, which will have to be followed sincerely and make sure that it's done. We need to act now, because if we don't act, mind you, as I told you, there's digitalization which is coming. There's digitalization. Once I was phoned in Zimbabwe by a specialist from UK who wanted to see patients from Zimbabwe in their rooms. Then they see patients. And should we put our public to that? We can't. Should we put our public? Neither can we also treat patients in UK or in any other country without their permission. So it's high time we should look at this advancement in technology and see how we can address it for the safety of our public. So that's what I'm looking at, for the conference to sit down and pick the issues that it be said, have a strategic meeting, then move forward.
Lastly, Ms. Josephine, when you look at where we are, I know when it comes to millennium development, yes, 2030 is around the corner. We are already in 2022, towards the end. Do you think the continent will be ready to implement yes?
I think we will be. We will be, because I'll give you an example. Like in our country, we are starting to change the program of training to meet the World Health Guidelines. I think in South Africa is also doing that. That's why you heard Namibia, if you were in the ministers' meeting, the minister of Namibia saying, we now need to have, as I say, we now need to have same standards of training. Because we have got same social, not economic, but social problems and cultural problems. We now need to sit down and look at what is it that we want. Given all these challenges, where do we want to go? Yes, I'm very positive that we will. We will, definitely, we will. Because all we need is us. Nobody will do it for us. It's us who have to wake up. So from this conference, I'm really challenging Prof. Mtati to stand up and really drive this agenda forward. We will definitely meet universal health coverage. We'll be there because we need to scale up our health services. We need to look at, if you look at all these presentations that are going to be there, they are talking about how we've reached there. Yeah, I'm going to present about health workforce, retention and strengthening of health workforce and regulation of the future. I'm going to talk about that. I've got a presentation.
After the break, we'll listen to an interview done by Zama Buthelezi at the 24th AMCOA International Conference hosted by the HPCSA that is currently underway in Sun City, Northwest Province. Now, she spoke to Professor Simon Nemutandani, the President of the Health Professions Council of South Africa, about facilitating an exchange of information and meaningful collaboration among healthcare practitioner regulatory bodies and authorities, which will provide for development of concepts as well as new approaches in health practitioner regulation. Stay with us. Welcome back to Vital Signs. The 24th AMCOA International Conference will address the full range of issues and challenges now facing the regulatory authorities globally underway at Sun City Resort in the Northwest Province under the theme, the workforce or the health workforce of the future and its regulation. Now, the continent's health regulators, academics, health care professionals, policymakers and members of the public will be facilitating an exchange of information and meaningful collaboration amongst healthcare practitioners and, of course, regulatory authorities, which will provide for the development of concepts and new approaches in health practitioner regulation. Vital Signs producer Zama Buthelezi is there, and of course we'll listen to an interview that she had with HPCSA's President Professor Simon Nemutandani.
Prof, the theme of this conference is a healthy workforce. I know in different provinces we've had issues from depressed health workers, especially during COVID, where there were long hours and people were complaining that they are stock out, we cannot treat patients, we don't have enough beds. Was this theme prompted by what has been happening?
Well, this theme has been coming for years because we realize that the health workforce, it's a dynamic thing that takes place all the time. We cannot have the same health workforce of 50 years ago. We need to move with time, technology, and nature of diseases and how people move from one area to another. Let's take for COVID. It's a disease that has just come up now. So we need to make sure that we have a workforce for the future, and the regulation and regulatory bodies should advance with the future.
Prof, COVID came with issues of electricity as well, which were faced by the country, and we still have load shedding. Sometimes we load shedded as households 3 times a day. And recently we've been told that hospitals have been exempted. But looking at the impact that this has done on the hospitals, what are your concerns as the Health Professions Council about what has been happening in our hospitals and the impact on the patients that you're servicing?
Well, you see, the load shedding has a big impact on the life of our patients. For an example, that you've got an emergency and you are operating in theater, immediately lights get off. The generator doesn't kickstart. Patient life is at risk. Now, we have heard what the minister has said and what is said in the media, but we are not satisfied with it. We want all facilities, public and private clinics all over South Africa, not only in Gauteng or the big hospitals like Bara, Steve Biko. We want the hospitals in rural part of South Africa having electricity all the time so that we can save lives. So for us, this is a challenge that we're making to Eskom and those that are in authority, government, to make sure that they must solve that problem. Our patients' life are at risk. Practitioners are also afraid to go to a facility, start a procedure that would not give a positive result. It's unethical for any doctor to start a procedure when you know that life can be lost during the procedure. That should not be encouraged, but it's a risk that our practitioners are taking to make sure that lives are saved. But we're calling on government to solve the problem.
Prof, you know, this conference comes at a time where we've just heard of a bogus doctor who's been servicing patients in one of the provinces, and he's being accused of 2 rape counts. Does this show maybe loopholes in the system that these syndicates have seen, and as a result, they're taking advantage of that I can practice for months, even a year, without being detected?
Well, as you are aware, Health Profession Council of South Africa regulates registered practitioners. So those who are bogus doctors, who claim to be doctors from anywhere, we would not be able to know whether they are registered or not. But we are calling on all our patients, whenever they visit a facility, to make sure that they check on the board or demand that this practitioner is registered. It's a matter of 5-10 minutes. If you've got app or you've got a WhatsApp, you could just ask from HPCSA, we'll be able to give you a response immediately that that doctor is not qualified. But we also have a unit that is going around provinces to make sure that those bogus doctors are found out, rooted out, and we are asking the law enforcement to make sure that they deal with those issues whenever it's public is called upon to report if there are such issues, to make sure that we deal with them.
Prof, lastly, I just want to find out from you whether, as the Health Professions Council, are you able to talk to other countries in terms of registering doctors coming from other African countries to verify their qualifications before they are registered with the Health Professions Council to avoid the complications that have arisen?
Yeah, we have countries that we have checked their standards and visited their universities to make sure that they are on par with the standard here in South Africa. But as you know, there are countries like in Ukraine, Russia, where it happens that those universities, their standards are very low. And in some areas, the training is bogus. They have not seen the patient, it's only on paper, and they're expected to return here in South Africa and be registered. So we have refused that. We have also noted that there are those who cannot meet the standard of training here in South Africa, let's say the requirement of entering a university. So parents who've got money, they choose to take their kids to Europe or Eastern Bloc and pay a huge amount of money. And when these kids come back here in South Africa, they are not registerable. We are not going to register them. We make sure that we subject them to an interview and also a clinical assessment so that we do not release them in a community where they become a risk and they have not treated a patient. And these are serious challenges that we're having, and we're calling upon all parents not to just send their kids to Europe because they are bogus universities. They have never treated a patient there, but they are said they must go back to their countries of origin and treat patients. We are not accepting that. We are here to protect the public and guide the profession. So we will put our pressure on all those who go that side and wish to come back and practice. They will subject them to start all over again if their standard doesn't meet what we have here in South Africa.
Prof, you know, recently there was a story about junior doctors who have not been placed for years. Are you in communication as the council with the department to try and assist those?
We are concerned that while we have shortages of doctors in South Africa, the Department of Health and Treasury are not putting effort to accommodate those doctors in various hospitals. We have heard about that, especially some of the interns and those that have done post-community service. Government should make sure that they avail resources. Look, health in South Africa may be under stress for various reasons, but it is an investment. If we invest in the health sector, the Minister of Health should have enough funding to make sure that when you go to a facility, you have the resources. Now, that has been a problem beyond HPCSA. Universities continue to train, produce, but the absorption is the responsibility of government.
Lastly, I know we pressed for time. We're seeing a lot of doctors who are experienced, nurses who are specializing, who have left South Africa for greener pastures. How are you going through this conference, try to make sure that that is put to a stop? Because we need them. We saw with COVID where we didn't have enough health professionals at intensive care units. Is it going to be part of this conference? Are you concerned about this?
We are very concerned as HPCSA that we are losing experienced doctors. You know, it's a challenge that here in South Africa, as you get older, you get discarded and you become a person that will be thrown in a dustbin instead of being an investment for the whole society. Now, there are many factors that are pushing them to go to other countries. One of them is the working condition. If you are working in an institution where they have no equipment and with all your skills, you are doing a routine work that does not meet your qualification. The other factor is the remuneration that goes with it. Wealthy countries like Canada, Australia, they've got incentives that are able to recruit. I know that OSD has come into place, but there are many factors. We are calling upon all our colleagues. Some of them are coming back to South Africa, but they need to be of value to all of us. Society values their people, and we've got experienced doctors that if they come back, they do the best. So we are calling upon, and in this workshop, we will have a serious debate about poaching of doctors. We, South Africans, are also poaching doctors from other African countries. That has to stop. But some of the factors, as I was seeing there and discussing, is the issue of working conditions. You work extra hours, but you are not compensated accordingly, and that becomes a challenge. If that can be solved, and many other factors, we hope South Africa and Africa will be the best, and we would not have doctors moving to Europe or Canada. Thank you.
I've seen the guest list of delegates that are coming to this conference, and hopefully great ideas are going to come out during all the sessions. Are we going to see implementation finally, or is it going to be another talk shop because it's that time for the conference?
Our expectation is that resolution that will come from here, we will present them to Forum of Ministers of Africa, and it will be at the forefront of some of the discussion at the AU. We are pushing, and we make sure that now you have seen here, we've got ministers of South Africa. They were supposed to be ministers of Kenya, Ghana. For various reasons, they could not attend this, but WHO Tedros was here online, and he's encouraging us to work together. We hope that African ministers will take this conference and resolution seriously and implement them, because without them taking consideration of what we have resolved here, we are not going anywhere. We are calling all these ministers and politicians not to go to Europe. Let them be treated here in South Africa.
Well, there you have it, the end of our show. Thank you so much to you for watching, and of course, all the guests participating in our show. This has been Vital Signs. I'm Dr. Musam Tombeni. Take care.